Jason, how desperate is it to get funding from Washington to just protect at the most basic level our nurses, our interns, our residents?
Yeah, there's no question that there has been a delay in receiving funding, receiving PPE. We are starting to see improvements in that availability, but it's far too long and too late. We've seen healthcare workers around the world who have succumbed to this virus and been infected. Not only does that increase the morbidity and mortality within their own family, but it also takes them out of the health workforce, which has a ripple effect throughout the system.
Why can't the administrations of these hospitals go to the politicians and just say to them, look, here's a video, as I saw yesterday, of 8 ambulances outside Mount Sinai at 101st Street in Manhattan? Why can't the leadership of these hospitals explain to the politicians how unsafe this moment is?
Well, I think the leadership's doing its best to try to that explanation. It's clearly all over the media, all over social media. So I don't think it's an issue of lack of will, nor do I think it's an issue of lack of understanding. What I think is it's a lack of issue of preparedness. And so specifically what I mean by that is you can't, when there is no stockpile, when there is no substantial availability to immediately deploy to these hospitals, and you have an entire health system in a state across every state of the country requesting this at the same time, there's just a supply and demand issue. And so ultimately, all of this has been requested. It's been requested before the curve started rising in these locations, and yet there was just no supply to offer to the demand.
Dr. Farley, Speaker Pelosi and others, Republican and Democrat, are speaking about almost wartime pay for our medical professionals. Why are we battling about this? Why are we having a debate about the low payedness that everybody agrees we see in geriatric nursing, that we see in some of the entry-level positions in the hospitals? Why are we arguing about combat pay for nurses and doctors?
I think it's a great question. And first and foremost, I want to let your viewers and listeners know that it's not the healthcare workforce who's arguing about this, right? This is the politicians. So we're in there. We're doing our jobs. We're dedicated as we were before this pandemic began. And so I just want the listener to know that that's not something that the health workforce is demanding. That is something that we don't have time to demand. So when we think about these conversations, it is it is something that's happening for people who are safe and not currently in harm's way. That said, when we think about, wartime level rhetoric, I think this is a war zone against a virus, a different type of enemy. And these healthcare workers are putting themselves on the line. And I've heard everything from loan forgiveness as a type of remuneration to increased pay, and yet no one seems to have a clear guidance on exactly what that means. And by the way, healthcare workforce isn't sitting there waiting for that to come through. We're just doing our job.
Dr. Farley, I want you to comment on what you observe in intensive care units and in the general hospital now about biphasic illness, of how a virus can occur and the patients can be very sick, and then they get better, they do better, and then there's a resounding deterioration. From your experience and what you're learning nationwide, can you suggest that the COVID virus has a second life or so? Are you observing that clinically in hospitals?
We've definitely seen cases of patients who seem to be recovering and then have an acute decline. And so the key question is physiologically what is happening. And so right now there's a lot of hypotheses around what that is. Clearly, we have to remember that it is not the virus itself that's causing the issue. It's our immune system's response to it. So our immune system can begin a response. It can help to reduce the viral replication. And then once the viral replication is starting to decline, the virus has mechanisms to try to evade that immune response, and then ultimately begins to overwhelm the immune response. And so the immune system begins to really ramp itself up. And so what you're seeing with this acute respiratory distress is basically patients beginning to have fluid develop in their lungs with not only pneumonia, but also just frank fluid from all the immune response that occurs to the virus itself. And so that second wave of just really acute deterioration is a result of our bodies trying to fight back against this virus.